If you're pregnant, you and your baby could get seriously ill if you're not vaccinated against COVID-19 and flu. You can have both jabs at the same time and at any stage of your pregnancy. They'll protect you both now and for the first few months after your child is born. Don't delay. Double your defences. Get vaccinated, get protected. Go to nhs.uk to find out more.
This is our People podcast, telling the stories behind South Tyneside and Sunderland NHS Foundation Trust.
Hi and welcome to Our People podcast. I'm Harry Newhouse and I'm a PR and social media assistant here at the Trust. On today's episode we will be talking to our Legacy Mentor team, and here to do this with me is Jayne, Billings, Shobon, Lynch, Bency, Raseena and Jimmy Sarmiento. Welcome to the podcast, everyone.
Thank you, Harry.
Hello.
Thank you. Hi.
I'll start off by going around the table, and if you could introduce yourself and explain what your role is here at the Trust and what that involves. I'll start with you, Jayne.
Hi, Harry. I'm Jayne Billings and I'm Matron in the NMAHP workforce team, and I've supported the rollout of the Legacy Mentors within the Trust.
Hello, my name is Jimmy Sarmiento, just call me Jimmy. So I'm one of the Legacy Mentors for the acute hospital, and we are supporting Sunderland Royal Hospital, South Tyneside and Sunderland Eye Infirmary.
Hi, myself Bency Raseena. So I started as a first Legacy Mentor of the South Tyneside and Sunderland NHS Foundation Trust. I'm so proud and happy to be one of the Legacy Mentor, and we are supporting the staff, especially for those who are new to the Trust, less than 2 years of their career.
And Shobon.
Hi Harry, my name's Shobon. I am a newly appointed Community Legacy Mentor, and I've only been in post a couple of weeks, so I'm still very much in training.
Brilliant. So you're, as you mentioned there, you're all part of the Legacy Mentor team, which is a fairly new team here at the Trust. Jayne, what is a Legacy Mentor and why do we need them at the Trust?
So we've been really privileged to gain some funding through NHS England earlier on in the year to support the rollout of the Legacy Mentors. And what this is some healthcare professionals, in our case it's experienced nurses. The original was for later in their career, but we do have some, the team are sort of mid-career, but that's fine because they've got a wealth of experience that they can bring from their nursing experience. And also they've been mentors to newly qualified nurses in the past as well, so it's proven to be a really good success. So what we're doing, we're supporting newly qualified nurses, midwives and allied health professionals across the Trust and providing pastoral support, professional advice and some education. And also the Legacy Mentors have got that ability to pass on hints and tips that have supported them throughout their nursing careers within the NHS.
Yeah. And when Bency and Jimmy and Siobhan were applying for the job, who were you sort of looking for? What sort of qualities were you?
The ideal qualities is someone who is kind and caring, which I'm really lucky that the team are. They are committed to supporting and developing staff. They are using their experiences to show others how they can develop into experienced nurses, midwives and allied health professionals themselves. So that's an ideal Legacy Mentor, is someone with that coaching ability to support our staff and help grow our workforce and hopefully long term retain and keep them at South Tyneside and Sunderland NHS Foundation Trust.
Perfect. And you mentioned there, so you're all experienced registered nurses. Could you all talk, we'll go around the table again, but could you all talk about your past experiences to how you got to your role that you are at now? So I'll start with you, Jimmy.
Right, okay. Well, basically, if we're going to put it all together, Legacy Mentor Service, or we as Legacy Mentors, our main focus is sharing our experience, may it be bad experience or good experience, and able them to use these experiences or let them realize that they could use these experiences to transform into role development as a learning opportunity and also part of their growth system, okay? to be honest, I cannot remember any specific moments where I realized that, oh, I will be better a mentor, I will be a better coach, I will be a better teacher. But I could say, and I think it's part of my personality because I've been really independent ever since. Even I was working in the Philippines 12 years ago. Even when I was a student, I've been really independent and very, very interested in teaching, educating, and sharing my experiences, sharing what works for me. So I think when I started working in the trust, it's like a new environment for me as well. And that is also the time where I was able to develop my adaptation skills, which in turn now I am trying to give back or share with the new joiners of our hospital or of our trust. May they be an international recruit or may they be recruited locally. It really doesn't matter, but I think what more important is the transition or my experience from adapting to a new role, a new environment, new practices, policies, and approach are being used. I utilize them to my advantage, and the same thing that I am advising with my mentees. Thank you.
Were you a registered nurse here at the Trust before you were in the Legacy Mentor team?
Yes. So I was a charge nurse in colorectal surgery. So this is a secondment role for me. And I've been really privileged and thankful to Jayne and also to my previous manager that she's been very supportive and understanding that this is my passion. Passion is teaching is my passion, supporting staff or be of help to someone who I was on the same shoes before. Because 6 years ago, we don't have legacy mentors. Mm-hmm. We were like, I felt like we were being thrown in the middle of the ocean and we were just like, oh, you learn how to swim now. Mm-hmm. That's how I felt before. Because to be honest with you, 7 years ago, so the trust was very supportive with our recruitment and setting our expectation. But on a personal note, we were allocated on the ward and then we were trained for like 1, 2, 3 weeks. And then after that, the expectation comes in and then bigger and bigger as weeks goes by. And it is just on how the person would approach this kind of like changes that would make or break him. So in my case, I use this opportunity to strive in that kind of like moment and use that opportunity to grow and be better in my skill. And in just a matter of 2 years, I was able to secure a new job as a deputy ward manager in C30, which is colorectal surgery. And then a year after, I've been given a chance to join the group as a legacy mentor. So experience and mentoring really helps and make a significant changes to new recruits or to international recruited nurses.
Yeah, thank you. And Bency?
Hi, I just completed my nursing degree in 2012 in India. So, and after that I started working as a medical surgical ward nurse. During that time, I got an opportunity to work as an educator in the infection control. So I just started my passion of teaching and developing myself in the clinical education side from that aspect. And after that, I have around 12 years of nursing experience in Saudi Arabia as a bedside nurse educator in a critical care environment. And that makes me more skillful and confident enough with a lot of specialist procedures and skills. So from that time itself, I'm keen to support students and as well as the staff, and I'm always getting a good feedback on that as well. So from there as well, I'm realizing my passion to go and support nurses. But when I come to UK in 2019, I was as a nurse in intensive care unit, and I have around 3.5 years experience in intensive care during that time. The legacy mentor job being advertised, and I just read through the job description. Exactly, it suits like somebody is really passionate, who is committed and caring to approach staff who actually need those support. For me, I really feel like as an international nurse coming from a different country, I can really understand and think about their perspective. Since I came, I go through the OSCE, go through the preceptorship, and then I know what are the obstacles, what are the challenges which I face. So what are the way I overcome to be a successful Band 5 and gain experience of a 3 years of intensive care nurse. So I am very passionate and very compassionate to give and share my experience to those who coming to the new to the trust or the future coming nurses. I think we can share our experience, we can share our expertise to the future nurses. Really the Legacy Mentors is looking to have a more experience, more expertise. The nurses are always on the late careers of their stage, but people can support with their wealth of experience, wealth of knowledge to somebody. We can share our experience and passion to fulfill those who dreams with their newcomers to United Kingdom.
Yeah, and because as a trust we are very proud of the amount of international nurses we have at the trust, and it's such an important role to make sure they're all feeling good that they've came here, and it's just vitally important because that means ultimately better patient care if we've got happy staff.
Definitely, yeah.
And sometimes it's not just around their professional abilities and skills. It might be around their pastoral support, such as finding a place that they can worship and continue practicing their faith. That maybe someone might have special dietary requirements and not sure where to go for their shopping and things like that. So these things all impact our staff in different ways. So it's actually supporting them not just within their role, but also giving some guidance around settling their life in the UK.
And Shobon?
Hi, I'm Siobhan. I joined the NHS in 1984. Let's cough that away. Did not think about the length of time. And came into community nursing in 1990. So a substantial amount of time. And when I saw this Legacy Mentor advertised, I thought, why did nobody think of this before? I can pinpoint a lot of people who would have been very good at Legacy Mentors who've already retired, but I've always supported students and I've always been the go-to in the team for advice and things, so I hope that I can bring some enthusiasm and support people. We don't have very many international recruits in the community, but we're looking to have people join us very soon, and we're all very excited about that, and hopefully we can make that as smooth as possible for them and make them feel wanted and appreciated.
So does your role differ much from Bency's and Jimmy's that you're in the community?
I'm seconded 2 days a week into this post, and I have been only in it on a couple of weeks, so I'm very new. But most of my time is spent delivering healthcare in people's homes, so through district nursing, and it's very varied, it's very busy. So I think people will be having a lot to do when they come out into the community anyway. And it'll be very different for them, but I hope that they enjoy it.
So do many trusts in the region or even nationally have a Legacy Mentor team? Is it a popular thing to do in the NHS?
A lot of trusts have signed up to this because there was some funding made available that we could apply for. So we meet on a monthly basis with our colleagues across the region, which has been really good, and we can share ideas and benchmark with each other. And they're all very like-minded legacy mentors and managers who are like us and just really want to give the best for our staff. So we've got that opportunity, which has been really helpful. And I think, Jimmy, you've kind of gone further and communicated with them in email and telephone conversations and things, because we're all learning from each other. It's a new role, and I think that's really important that we do that across the region.
Yeah, that's right. So we've got in touch with a legacy mentor who works in Mid Yorkshire, in Leeds. We have an upcoming meetings with the legacy mentors based in Gateshead, and hopefully the legacy mentor in Newcastle Hospital will also be joining us on that meeting. But we're still trying to get in the dates on what's going to happen. So it's more of sharing the best practices and approach, since this is a new service in the NHS. So there is no established norms or procedure or policies that we could adapt, but learning through experience as well as legacy mentors and how we approach certain situation based on the circumstances of the staff or nurse, midwife, or AHP that we are supporting. So, but basically our intention is to cover in a most holistic approach as possible. We're not just there to support on the clinical aspect if the person is struggling on the clinical aspect, but we're also kind of like looking what might be the factors contributing why this person is really not keen on adapting with the new role. So possibly there's something underlying. So those kind of like things that we're trying to patch things all together whenever we try to support one. Yeah.
And I presume with each new staff member that you talk to, there's different case that you're always learning from different experiences they've had as well. So you're always learning, I presume.
Yes.
Yeah.
Actually, we have like a different experiences with each of the referrals. Like once we have like any of those staff who come to us for a support, we will just ask like a face-to-face conversation first. We will just write down like what actually their needs, is there anything we can help prior we move forward, which something can be sorted out on the root level. Some need to be have like more support, some need to be have like more signposting to some other departments. It might be a single conversation that make the staff feel secured, staff feel valued, that can be close the case. It's something like a communication, something like a religious practice, or something belief, or something they need might support some accommodation or some family issues that make the staff affected in the terms of a performance on the ward level. So a good conversation, a compassionate attitude that makes the staff feel more valued and relaxed.
You've already mentioned how you help our staff, such as international nurses, but you mentioned how this also helps our staff, but how do you deliver that support? And if a member of staff says, I'm struggling with this, how would you go about doing that?
Well, what happens is we either get contacts from ward department or team managers may get in touch to say they've got someone who's struggling and may just need a little bit of support. Also, people can self-refer into the service, so if anyone wants access to a Legacy Mentor, they can just contact us via our joint mailbox. We do get to meet quite a lot of new recruits because we're part of the Preceptorship programme. So we do a presentation on the Preceptorship programme to introduce ourselves to the newly qualified nurses, midwives and allied health professionals. So there's routes of how people can get into the service. And then when we do meet with someone, like what Bency said, we just have that initial conversation to go over thoughts, feelings, any concerns that someone has, and we talk those through with people. It's a bit like a mini counselling service at first, but and just share our own thoughts and views as well, and our own experiences as experienced nurses that we can help support. So that's.
Yeah, and you mentioned there the Preceptorship programme. Mm-hmm. Could you go into a bit of detail what that is?
Yeah, we work really closely with our colleagues in NMAHP education team, which NMAHP's short for nurses, midwives and allied health professionals, and they run the Preceptorship programme for newly qualified healthcare professionals, and also our internationally educated colleagues who've joined us recently in the trust. So that sort of runs once a month, and it's a programme of education to really introduce people to the trust around patient safety, care planning and things like that. So it's really important that people do that programme when they're newly qualified. And we're part of that now, so we are part of that and offer our pastoral support and our service to those people. And actually some have then approached us after the Preceptorship programme to ask for some additional support, which is fine. And then myself, Bency, Jimmy or Siobhan will then go and see those people in their clinical areas and sit down, have a discussion with them. And it may be that they need some support around aspects of tasks and roles in the clinical environment, which we can help with and support, and then also link in with the Preceptorship team. So we're very much part of a wider team, supporting with the Preceptorship team, the clinical educators, the preceptors on the ward, the people who are mentoring the newly qualified staff. So we're definitely part of that team, and I think we all complement each other quite well.
And since the team's set up, can you already see the benefits this has with our staff? Have you received much feedback at all?
Yes, definitely. Not just on the clinical aspect, but more on the pastoral side, to be honest. I have seen this person who I'm supporting, and this person is really anxious in terms of her job security because of the job requirements and what, like for example, for the nurse to be to be registered with the NMCs, they have to meet English language test, OSCE, and also the CBT. And this particular staff that I was supporting was really anxious that she's not able to meet up on the time frame those requirements. And she just started crying to me, and she told me that, oh, if I had known you before, I would have asked you to give me support from the very beginning, because I just don't know where to go or who to ask or something like that. But the moment that I met her, set her expectation, and then communicated in a wider team, her manager, Jayne, our international recruitment matron, Mayflower, and also to Anthony, and told them this is a situation of the staff. She's really anxious on her job security because of the NMC requirements or because of the requirements. So we came up with a resolution on how can we help her in short term and also in the long term. So we already got the plan, and now she is still happily working with the trust, and I'm continuously supporting her from the pastoral side, just to keep check on her if her emotional side or her mental state or the whole well-being are in check. So that's one good thing.
Yeah, it's really lovely to get some of that feedback, and we get some staff email us to say thank you and how much of a difference it's made. We also get quite a few emails from the managers of those staff as well, because they're really pressurised in the clinical areas. So I think they really value the additional support that the service is giving them to support their staff, because that's what they really want.
They're all very, very busy, aren't they?
Mm-hmm.
They haven't got that extra time to
Have that one-to-one support with a lot of stuff. Right, that's brilliant.
And it is also, I think, makes a difference that having a go-to person or a go-to figure that they know that been on their position years ago, like that would give them kind of like a different kind of confidence or ease among themselves, that, oh, this person has done this and is still with the trust, doing this, doing that, I can also do it. I just need to be guided.
If any of our colleagues who wanted to get in touch with you, what's the best way to do so?
We have actually the Legacy Mentor referral form, so that can be filled out by the Trust Legacy Mentor Service website, or we have like 3 legacy mentors at the post, and Jayne is our matron at the NMAHP workforce, and Jimmy, myself, Bency and Siobhan. So we have our own personal emails as well, but we send out our trust web address for the Legacy Mentor Service to fill out the referral form. Actually, it's not necessarily to get the managers or a band 6 deputy to be filled the form in, but the staff, if they need support, they can self-refer. There is no boundaries, there is no set limitation, they can feel to come us directly to talk. I have an experience couple of days before, one of the staff, while she's on the road, I'm just crossing, and she comes straight away to me and telling that, oh, I'm going through this and this. So I told her, don't worry, so we are here to support and help. So she come to me in terms of her OSCE support and little bit more support additional. So she feel like I think the service is getting more welcomed and valued, and the staff is come directly instead of getting the managers get involved. But it's up to at a level, like if there is any problem with the performance management or there is any issues on the board level, the managers can refer to have more support. Otherwise, the staff can directly come to us to offer more support.
So just in case there's any staff listening to this and be like, oh yeah, I really want to get in touch with this team, what's the best email to get in touch with you?
The best email to email on, and all of us check the mailbox, is stsft.legacymentorteam, all one word, at nhs.net. So that's stsft.legacymentorteam@nhs.net, and we're on the global email address, so if you just type that in, you'll find that.
Brilliant. And that brings us to the end of this episode. So thank you very much, Jayne, Shobon, Bency and Jimmy, for joining me today and talking about what you do in the Legacy Mentor team.
Thank you
very much, Harry.
Thanks so
Thanks
much
for having us.
Thanks for joining us for this episode of our People podcast. We hope you enjoyed it and check out our other stories. Hit subscribe to keep up to date with the latest and catch up with what we've been up to on our Twitter, Facebook and Instagram pages. Just search for our name.